All right, everybody, I am very, very excited to introduce to you our medical director and my personal friend, Dr. Glen Shapiro. Glen, how are you?
I'm doing great, Brady. How about yourself?
I'm not fishing enough. That's my biggest issue that I've got right now.
That's my recommendation, 10 to 2, 10 to 2.
Glen and I met on a fateful November morning in 2016. We had a mutual friend that brought us to the same fishing hole, and we've been friends ever since.
I think he hooked us up.
This is true. So Glen, so you're our medical director for Sensor Medica Clinic. Why don't you give me just a little bit about your background, your specialty, and so forth?
Sure. Well, by training, I'm mostly a fly fishing guide. No, I'm an orthopedic surgeon. I've been board certified and recertified, have worked in all sorts of clinical practice settings, from one of the larger medical centers in the country to downsizing to small rural hospitals. Spent the last decade and a half in Idaho, living here and practicing here. And love to put things back together and like getting folks back in the game.
That's awesome. Our catchphrase that we're using here with Sensor Medica is joint preservation. Tell me what that means to you.
So I think in simple terms, I can make it as easy or complex as necessary. But as a board certified orthopedic surgeon, my passion at work is to get folks back to their normal daily activity. And whether they have a fracture, a tendon or ligamentous injury, some trauma, I usually try to get them fixed up and get them back doing what they want to do and try to do it as painlessly and as quickly as possible. Joint preservation is a little more complex than that because it's taking active steps and actions to help avoid those injuries in the first place, maybe even avoid surgery so that you're never out of the game. So the real question then becomes, why did I get injured or what happened? And I think the clinic is really unparalleled in how we can evaluate your gait dynamics, do it dynamically, and then use that data to get your normal for you with or without an injury and specified to a specific problem or joint to help you get there.
That's awesome. One of the things I've always appreciated about you when we met, I was in functional neurology and working in chiropractics, and we had so much in common about just joint biomechanics. And I've always appreciated what's the playing field? I can't think of the word I'm trying to think of.
I think it's a joint connection.
A connection, yeah, that's a good one. Then when I started moving into regenerative medicine, I saw the light turn on in your eyes, and tell me what your thoughts are on regenerative medicine.
So the way I like to think about it is regenerative medicine is all about helping the body do what it does better than anyone can do for you, and that's heal itself. Surgery sometimes is a necessary step for a lot of folks, depending on the injury or the problem. But the goal of regenerative medicine is to help the body stimulate new cartilage, to help reduce inflammation, and to use alternatives that aren't necessarily possible with pharmaceuticals or with reconstructive surgery. It's really about providing the proper environment and coaxing the biologics of your body to help the body heal itself. So if we can come up with a way to stimulate your body to ramp up its growth factors or cytokines, if we can provide a concentrated dose of some of the growth hormones, or we'll call it the silver bullet that helps the body heal, if we can provide it from an outside source that will be safe and help you get there faster, then that's great. And we've been using amnion and chorion, which can come from a mother during and immediately post-pregnancy without any harm to the mother or to the baby. we can just help maximize your body's environment for healing and for repair.
Yeah, it's been just absolutely amazing to see some of the things that we've done. I'll give you a perfect case from just a couple of weeks ago. This woman, she's I think she's early 60s, and she's still working as a CNA, so a certified nurse's assistant. And you know as well as I do how hard those individuals work. She works in a nursing care facility, and had a lot of issues with her spine. Had a lot of arthritis and arthrosis in her specifically in the facets, where those joints were breaking down. And for her, when we applied the principles of regenerative medicine, it was almost an instantaneous change. And now I'll have a blip about her on Friday. But she's just doing awesome, and
That's great.
It's fun to apply those principles in the clinical setting. Number one question I get all the time, and you've already touched on it, is where do the stem cells and where does this regenerative product come from? And you said it perfectly. It comes from is donated birthing material. There's absolutely no harm whatsoever done to the baby, done to the mom. This material is all screened, it's all tested, we know that it's safe, and it's not coming from dead babies. I don't know how much more clearly I can say that, but that is the number one question that I get. Number two is people want to know, number one, does insurance pay for it? Number two, why not? Can you touch on that for me, please, Glenn?
Sure. Yeah, no, we can't say that enough. The products and the programs that are set up not only are, as you said, using this from not only the mothers, but the birth products that really don't get saved or used for anything until this kind of pioneering event took place. But the screening process starts way back at the time that a mother decides to enroll in the program. It's all voluntary. It's not only testing of mothers, but testing of their spouses for all the possible things that we know about. And we kind of extrapolate out to things that we may not know about yet. And if there's any question, my understanding is about 50% of the product that is harvested and used is actually only used for research, period. The other 50% that meets the highest standards then can be applied to human use, and that's what was accepted by the FDA. In terms of payment, it's unfortunate at this point that the wheels of progress sometimes grind to a halt or move very slowly. We've seen that in this past pandemic, but the FDA has cleared the procedures, but they're not yet approved procedures, so they can be used at a physician's discretion in ways that are appropriate, and we're defining that more and more each and every day. But third-party insurance carriers are not covering these expenses at this point, and they'll do practically anything and everything they can not to pay for any modality until it's basically approved by Medicare. Once it meets Medicare okay, then it seems to be acceptable because there's no way not to. So it's coming, but it's going to take time. I kind of visualize it as an artist's palette. There's a large palette of options of treatments that we can use. And just like an artist picks or blends colors together, it's going to be based a little bit on what your problem is, primarily, what your need is, and then to make it into a package that works economically and financially for each patient.
Right. And just to be clear, we do, our team, we do have a ton of payment options. So once they ask me about insurance, then it's always, well, do you take monthly payments? And the answer is absolutely yes, we do.
Of course. Sure.
So there are some lower cost alternatives to regenerative medicine. So it doesn't necessarily just need to be a stem cell, or at this point, we're at the 4th generation of stem cell therapy. We're on to exosomes now. It doesn't just need to be an exosome injection. We have some other options that we'll talk about. But before we do that, though, what type of conditions does regenerative medicine help with?
So again, in broad strokes, I think regenerative medicine and stem cell therapy are best at reducing inflammation and at stimulating the body to repair and or regenerate new tissue when that's needed. So honestly, any inflammatory condition or degenerative condition can be addressed with these modalities. And the kind of the term itis, I always think of the word itis slightly different than you might have characterized it, but as the decade of the 40s is the decade of the itis. Really, before you hit 40, itis doesn't really happen for most folks, but at 40 up, that whole decade, maybe extrapolating for 2 decades, itis is a very common term. So whether it's arthritis or post-traumatic arthritis, which is basically arthritis that happens sooner than we might expect it to happen after an injury, usually at a younger age. We can use regenerative medicine and stem cells in knees, shoulders, ankles, wrists, fingers, toes. I mean, I think those are probably the simplest places, is in the periphery. And then when we get closer to the core for hip and spine use, then we usually end up using additional modalities for exact placement, whether it's fluoroscopy or a special setting. But all the other things can be done in a clinical exam setting very easily.
Right, right. So what are some of the other options that we have?
So options can include shockwave therapy, laser therapy to help releasing growth factors and cytokines. The modalities are completely pain-free. They're non-invasive. They're, in terms of dollars and cents, they don't attack the pocket very hard. And the idea has been a tried and true approach really back to the Greeks and Aristotle, and that was causing microtrauma. And the treatment for a dislocated shoulder was just to sit around the fire, drink some local drink, and grab a hot poker and stick the guy with the poker and cause some microtrauma. And what they found back then, thousands of years ago, was not only did it hurt a lot, but it actually kept the shoulder from dislocating because everything scarred in and it worked. So we're not really doing that. We've extrapolated and fine-tuned this a little bit better to very finely use laser-guided pinpoint accuracy to figure out how to cause microtrauma in the way that's least traumatic and most beneficial for the body.
Just to be clear, there's no fire pokers.
Or Greek beverages. Yeah.
So this, by the way, this was water that I just sipped out of.
Yeah, I put mine away. We're okay. So the goal, a common term that was actually coined back 20 years ago by Dick Steadman out at the Steadman Clinic, is what's called a biologic healing response. And he used it specifically for treatment for knee and ACL injuries, but that's what we're doing. We're using a variety of biologics, energy, or injectables to, sometimes even just the tip of a needle can be used to cause and stimulate the body to respond. And the goal is to speed up the process. Just say, hey, it's like a lighthouse. We know you're out there, but we don't want to hit those rocks. We want to get in safely.
So my nephew, he's always asking me questions about what I do for a living. And I was explaining to him, PRP, or not PRP, but I was explaining to him shockwave and laser. And I think he coined it perfectly when he said, so what you're doing is tricking the body into healing itself.
I think, yeah, coercing. I like tricking is a little harsh, but we'll go with, from the nephew, it's perfect. Yeah, the idea is to set up the best possible environment for the best possible result. Absolutely. I mean, you can sit hunched over at your desk and have back pain at the end of the day, or you can change the ergonomics of your workstation and feel like going for a run. So I'd lean toward the latter. Pardon me as I have an appropriate COVID moment. I'm going to sneeze into my elbow. It's allergies.
Bless you, sir.
Okay.
So let's talk just about injectables for just a minute. You and I have both hinted about PRP. I've often called PRP the first generation of regenerative medicine. In fact, I have a book right here that is a compilation of hundreds of studies that have done on PRP.
I have that book.
It's a good one. It's hundreds of studies on PRP and what we've done with it. But
sure.
Again, what are we doing here?
Sure. I think probably it'll help the average folk and myself included just to define what PRP is a little bit better. So it stands for platelet-rich plasma. And our blood basically has we're splitters divided into two parts, the cellular component and the liquid component. So the liquid component is that we have red cells, white cells, and platelets. Platelets are the smallest of the cellular component, and then the rest is liquid, and we call that serum or plasma. So if we separate out those components of blood, we literally use a centrifuge. It's a device that spins at high speeds, and we have a defined protocol. It allows us to concentrate those platelets as well as the proteins and biologics, the cytokines, the growth hormones in that liquid portion. We don't want to inject cells, even your own cells, back into people, but injecting the supernatant or the liquid portion of that separated product is what we refer to as PRP. And there are a number of different companies and a number of different brands, and we've learned a tremendous amount in the last decade about the pH. Sometimes you might think, oh, well, we'll just keep throwing more and more at it and that'll be better. But if you've ever baked, trying to make cookies, adding an extra 4 cups of sugar doesn't make a better cookie.
Right.
So I like the cooking kind of analogies in medicine. We're fine tuning it. If I were to set out all the best ingredients on the counter, the best butter, the best cream, the best milk, the best sugar, we still don't have the best whole house cookie. Now, what we're doing right now is we know all the products are good, all the things that we're choosing from are excellent, and we're fine-tuning how to get that perfect recipe to make cookies from the sauce.
So the centrifuge that we use, by the way, spins at 3,600 RPMs.
Oh, well, mine spins at 3,650.
Oh, okay. I see how you are.
I would never do anything like that. In terms of kind of you divided PRP as kind of the first line or first stage. If we don't count the hot poker from the fire, then we go to second generation technique using your own stem cells. So that way we actually use the body's stem cells in the same types of applications, and they can be used in the office. I often use them in surgery. When I'm reconstructing a ligament, we'll bathe the ligament in your body's own cells while it's waiting to be implanted to increase the odds that it's going to stick, that it's going to work. And while the data is still really in its infancy, it's looking promising in just about every aspect.
Yeah.
If we want to jump to third generation, we can do that. Third generation is basically where science has confirmed, there we go, yeah, mesenchymal cells. That's using amniotic and chorionic products. So that's the planned harvesting of the amnion and amniotic fluid, as well as the layer or chorion from the mom at the time of birth. And these so far, we thought they were the best of the best. And we keep basically getting a little smarter, just a little bit each time. We're fine tuning those cookies. Some people like them firm, some people like them gooey. But the goal is to get baby boomers, weekend warriors, and the aging population like me to stay in the game longer and to be able to be active and do what they need to with less invasive surgery.
Yep. So now we're on to the fourth generation. Is where we're on now. This is this whole exosome principle, which is it's kind of a mind melt for me.
Yeah, Watson and Crick didn't have any idea when they came up with the DNA helix that it was going to be heading in that direction.
No kidding. So exosomes are the chemical messengers that stem cells release. So now we have the ability to isolate just those messengers. So it was taking everything we knew that was good from the umbilical cord stem cells and super concentrating them down to just the chemical messengers. So now it's just messenger RNA that is telling your own cells to kick it into gear and to produce your own tissue.
It's fascinating.
It's an acellular product. There's no DNA transfer whatsoever because there's no DNA. I think you're absolutely right. Watson and Crick probably just rotated 360 degrees in their graves, seeing what we've done now.
There is actually a little known fact, you'll appreciate this from the very start of our conversation. There's a great little fishing spot just behind the Cold Spring Labs where I grew up, because I grew up not too far away from where Watson and Crick did their research on the North Shore of Long Island. And there are some great bluefish and snapper fishing right behind the lab. Anybody. I haven't been there in 20 years, so I don't know what's there now. There might be condos or it might be a Best Buy, but hopefully not.
Glenn, do these procedures hurt?
They don't hurt me ever. I mean, I'm always on the correct side of the needle as far as I'm concerned, but with all kidding aside, shockwave, laser, and other kind of office modalities, no, those are completely pain-free. They're non-invasive. Once you poke the skin, whether it's with a little needle, a big needle, make a cut for surgery, that's an invasive procedure, and yeah, it hurts. It doesn't, there's no way to make it, to knock people out. People would often ask, especially people like me who are squeamish about needles. I wasn't kidding about being on the correct side. If you want, I'll tell you a fun story later, but I always basically say that, when someone asks, well, can I be knocked out for the office injection? Like, you can put your mind anywhere you want to put it. Meditation works great, but no, we're going to do everything absolutely possible, not only using appropriate sterile technique, but to minimize the trauma and to make it easy. And what I've learned in my practice over years and years of doing this, and both giving and on the receiving end, is what a lot of offices and clinics will do is they'll inject your skin to make it numb. And before that needle hits the tray, the next needle is injecting what needs to be injected. And it doesn't really work like that. Yeah. If you talk about, you tell Brady 1 or 2 fishing spots after the skin is anesthetized, and then you get your injection. If you wait that minute or two and have a conversation, then the injection can be pain-free. And I am the most squeamish person, honestly, that I know. I am absolute, I won't even say it.
I'm with you.
I wait 5 minutes after my skin is injected before I had my last PRP injection.
I'm with you on that, Glenn. I cannot stand needles. And somewhere, there's a great picture of me right before I got the first stem cell injection with a very horrific look on my face. Let's hope that picture never surfaces.
Never surfaces, yeah.
But we've literally had 85-year-old women after the injection say, "Is that it?"
Yeah.
So
yeah. I've had a lot of folks have no issues. Every now and then somebody has more of an issue that with no clear explanation. There's no predictor of it, but using the right technique and doing it safely, sterilely, and properly is the right answer, and that's how we do it.
And I will put a plug in for our office right here that no one in East Idaho has done more of these procedures than we have, and we know how to make them.
Practice does help. That's why we call it the practice of medicine.
That's right, absolutely. Glenn, I cannot tell you how excited I am to have you as part of our team.
Well, glad to be here, and obviously, stay tuned because the best part of the team is coming soon, and that is Dr. Vicki Shapiro, a board-certified emergency medicine physician who is at the helm as well. She is the rocket scientist and star.
She is absolutely brilliant and kind and lovely, and is going to look a lot better on camera than you do, my friend.
No question.
So last thing is the part about what is next for those folks that are listening all the way through. and that
Sure.
is, I will leave a link that they can set up a phone consultation. We love doing phone consults right now because no one wants to come out of their house.
Sure. No, and
So
being proactive and adaptive is great.
if you want to make an appointment with a member of the team, then we can hop on a phone consult and we can at least preliminarily try to figure out whether or not this is a good fit for you.
Sure. No, I think that's great. And doing phone consults is right now certainly the way to go. I don't think that'll be the necessity in the future. I do think it's worth taking a minute to talking just briefly about risks, benefits, and downsides, because that's a common question that people always want to know. And my feeling is this, for the person and the patient coming in, is usually the first time, or they've heard about it, or they may have had good history or bad history. They don't really have a lot of groundwork. I have other patients in Ketchum who come in with 4,000 pages of printed National Index of Medicine reports and studies, expecting answers for all of them. And we take care of the full gamut. My feeling is this is commonplace bread and butter stuff for us at the clinic. We do everything systematically and with proper care and technique. In a reputable clinic, that's really what you want. You want to have, you have to agree that there will be some minimal discomfort with an injection. And the biggest concern is you may not get the exact desired effect you're hoping for. And that unfortunately is because we don't, it's not 100%.
Right.
I can't even give you a percentage. We know it all makes sense. It all should work. We have great experience and we're learning and getting more and more information from the scientific data every day. I think it's key that the staff, which you'll find at the clinic, will do every time is they'll discuss with you the risks, the benefits, the alternatives at a level that's most understandable for each person. It's a person by person approach. And this happens before anything is done other than conversation. Talk, I said, yeah, talk is cheap.
Right.
You need to have that level of comfort. In terms of what's being next, if you're tired of being laid up, injured, you're tired of chronic aches and pains, you've had a new injury, goal again is let's get you back in the game. Call, schedule an appointment, do a phone appointment. Let us help you determine if what we're offering is something that'll be helpful for you. And if it's not, we'll say so. And if it is, we'll get you signed up and we'll get it done. So don't wait because your health depends on it.
Yeah, thank you. Glenn, I appreciate it, man. Thank you so much for joining me.
Yeah, I got to go and go catch a couple of fish.
Look forward to doing more of these videos face to face.
Yeah, that'd be awesome, side by side.
Yep, absolutely.
Not necessarily, we get the wide angle for 6 feet apart. And look forward to visiting with Dr. Vicki soon. She will help.
We will get that on schedule for sure.
Up to speed. Super, Brady. Thanks.
Thanks,
Peace.